All right, guys, on this episode of Medication Review, we're going to be reviewing Midazolam, otherwise known as Versed. So this medication is a CNS depressant and is actually considered a short-acting benzodiazepine, which means it does have some anticonvulsant and anxiolytic properties, which is why we use it for seizures and anxiety patients. So just like most of the other benzodiazepines that we've learned about, you're going to notice that many of the indications and contraindications are the same, though there are some subtle differences. So just like the other benzodiazepines that we've learned about, how it works is it enhances the effects of gamma-aminobutyric acid, or GABA, within the body, which means it depresses the central nervous system, which results in decreased seizure activity, reduced anxiety, some minor amnesic effects, and really a relaxation of skeletal muscle. It just decreases the excitability of the central nervous system. That means that our indications for use of this medication are seizures, chemical restraint in psychosis patients, and then really that's going to be your excited delirium patients. And then we do use it for sedation prior to RSI, cardioversion, and pacing of patients. Your contraindications, always hypersensitivity. We have hypotension and shock, just like we learned in last week's medications with Valium, right, because of the hemodynamic effects of this drug. And then you're going to notice acute narrow angle glaucoma, still have head injury, and drug or ETOH intoxication. Now, what's important to point out here is that when we talk about this acute narrow angle glaucoma, the reason that they have this listed as a contraindication is there are some studies that have actually indicated that use of benzodiazepines in patients that have been diagnosed with acute narrow angle glaucoma, or any type of glaucoma for that matter, can suffer the effects of increased intraocular pressure, which could lead to permanent blindness for these patients. So that's why they tell us to stay away from the use of benzodiazepines in patients with glaucoma. Our dosing is actually not too complicated with this medication. So for adults, if we want to give it IV, we're going to give 1 to 2.5 milligrams IV push. We can repeat this. There is no max listed currently on this drug card. However, many of your local protocols will have a max dose listed on there, so you'll have to reference those local protocols for that. If we do want to give it intramuscular or intranasal, we do have the option of giving 5 milligram increments via that route as well. For your pediatric patients, your IV or intramuscular routes, we're looking at 0.1 to 0.15 milligrams per kilogram. 0.1 milligrams per kilogram is the standard dosing regimen that you're probably going to see in most of your protocols. Again, there is no max listed on here, but you'll have to look at your local protocols for that. And then we do have the option to go intranasal with that, and we are going to increase that dosage. You can see we basically double that dosage, so 0.2 to 0.3 milligrams per kilogram intranasally for administration of midazolam. So that's just a quick overview of midazolam, or Versed. Again, it is a short-acting benzodiazepine, and we want to stay away from use in those patients that suffer from glaucoma because of the risk of increased intraocular pressure, which can lead to permanent blindness in these patients. That's it for midazolam, and we'll see you on the next episode of Medication Review.